In 2021, the California Department of Public Health launched the California Equitable Recovery Initiative, or CERI, to strengthen equity across the state. Local health jurisdictions use funds to meet the unique needs of their communities.
Hello everybody, I'm Claudia Medina with the Office of Health Equity. I'm here in Nevada County to talk to the public health staff about the CERI grant.
Hi, I'm Jessica Ferrer. I'm the Mother-Child Adolescent Health Director at Nevada County Public Health.
Good afternoon, my name's Elias Ortiz. I am the Health Equity Coordinator with Nevada County Public Health.
My name's Toby Gavon. I'm the Program Manager of the Health and Wellness Division for Nevada County Public Health Department.
I love Nevada County. We have amazing natural beauty and incredible communities spread across a pretty rough geographic region. Overall, it has a very small town feel. The people really support one another.
What was really nice about the CERI funding is, number one, it gave us the opportunity to hire a health equity coordinator who could really drive the work and really be responsible for supporting all of our divisions and departments when it came to implementing equity and making sure that we were building real capacity.
In 2023, the California Department of Public Health identified racism as a key driver for maternal mortality. And knowing that as a root cause and having the health equity lead be able to guide our efforts towards mitigating the impacts of racism on our families, it's been vital.
Under the CERI grant, counties were required to establish an equity lead position. In Nevada County, the Health Equity Coordinator has been essential in helping move health equity efforts forward across programs.
Having a position like mine puts equity at the forefront of programs. It takes time and it's a process, but it helps to lead the initiative and put it at the forefront. So if equity is at the forefront of a program, when we're going out into the community, they benefit from that. So I spent a lot of time within the first year building relationships and being very intentional about this position and what it is.
Through the CERI grant, Nevada County Public Health made it a priority to link families to mental health services during home visiting programs using trusted messengers in the community.
Similar to many rural communities, we have a higher suicide rate than the national average or the California average. And I think we could see in the data and in the conversations that we were having on an everyday coming out of the pandemic that people were struggling.
We really recognized that there was a group we weren't reaching, and the isolation that all families were experiencing led us to really find ways to reach people where they are and provide trusted messengers. So the Promotora program started out with helping families understand vaccines, and it then led to home visiting programs that are bilingual and with home visitors that are embedded within the community already as a trusted messenger. And it's been able to get moms to get better prenatal care, to connect more with the community. We have Spanish-speaking parents groups here and in Eastern County, and it's really fostered a lot of community and some good programs.
Although the Moving Beyond Depression program was not funded by CERI, it served as a valuable resource that individuals were connected to during the CERI-funded home visits.
We have implemented the Moving Beyond Depression program, which treats mothers and families of the youngest kids. And that effort has really been effective at highlighting how generations can form. And we're really hoping that in several generations, we're going to have some kids that are healthier because of it. We really have seen that investing in the growth and development of our youngest children is far better than going back and trying to fix problems once they develop.
One of the things that we really wanted to do is go into schools, beginning in middle school, including high school, and then also working with community partners to really put on trainings that focused on identifying those warning signs. So what are the warning signs of suicide or that somebody might be struggling with their mental health? And then once that's happening, for younger folks in schools, starting to think about who are the peers or caring adults in my life that if I'm struggling or if somebody I know is struggling, that I can connect them with to get access to care. And so in all of these situations, we work directly with guidance counselors, teachers, administrators at the schools to arrange these trainings and provide these trainings. And they're in the room too, so we can say, hey, your guidance counselor is over there in the corner, so that if anything comes up or you're ever concerned, please reach out to them.
In addition to their efforts to connect with youth, Nevada County Public Health also found a way to support the wider community.
One other thing that, as a result of SERI, was our health supply vending machine program. And so we have 5 health supply vending machines that are located across the county. We have 1 in Truckee. We have 2 here in Grass Valley. We have 1 in Penn Valley, which is in Western County. And then we have 1 in North San Juan, which is a geographically isolated community. And we were really intentional about where we put those there because, number one, we wanted to make sure that we had 1 in Eastern Nevada County. We knew putting a machine in North San Juan that we weren't necessarily going to have the most people accessing it there, but it was going to be for a community that has a 20-minute drive to virtually all service providers, right? We're providing it for free. We're providing it low barrier. We're providing it in a geographically thoughtful way to make sure that everybody in the county are able to access those as well.
Looking back on their journey, the Nevada County Public Health team shared the powerful lessons that the SERI grant taught them about what it takes to advance health equity.
The ability to normalize difficult conversations, to be able to walk into a room and talk about a topic very candidly and normally when it otherwise wouldn't be discussed. To go into the community and be able to do something similar, with how we share information and sharing with the community. So I think those are big pieces that the grant was able to bring in.
One of the lessons learned is how important the capacity building work is, and how important data is when we think about, equity and improving the services that we're providing.
So phase 2 is going to be trust, and that takes years, decades, generations. And we're here to just keep showing up for the community and letting them know that this is our values and we're going to provide the resources and the programs that support them.
After meeting with Nevada County Public Health staff, it was great learning about the different ways they were meeting the needs of the community.